Namaste and welcome to the next lecture of Clinical Ayurveda. Myself, Dr. Mayuresh Agte. We are discussing Amla Pitta in detail and we have discussed now different shades of Amla Pitta which we see in our practice. In that regard, we will see another shade of Amla Pitta which is also very common and the treatment of it is also a very required treatment in our routine practice. So we have seen first one Agdimandi Amapatti Amlapitta, that type of patient and their treatment. Then patient which are more prone for ulcers or having erosion like features and then they claim as Udardaha etc. So we have seen the treatment for the patients with the ulcerative conditions or erosive conditions. Now third type which we come across, which we had discussed in when we had discussed Nidan of Amla Pitta, that patient has a vomiting sensation early in morning and many of them have a habit of inducing vaman or chardi in morning, and when they expel out that pitta, sanchita pitta, they are relieved and then throughout day they don't have any problem. In that regards, I have told you that this is pitta vruddhi. It is not the classical case of amla pitta as far as samprapti is concerned. It is the sanchita pitta, and that pitta gets expelled out in the morning or shows symptoms like rullas, and this pitta prakop or pitta vruddhi is because of mainly drava gunatmak, and hence it has got a vomiting sensation or it tries to get expelled out. So what will the treatment of this? Of course, Pitta Shama treatment, Shita Guna as a Pitta Shaman and Stambhane Himaha, by that rule that vomiting sensation or vomiting is to be can be controlled, and then as it is of Dravagunatmak Pitta, you will have to choose Ruksha Gunatmak Chikitsa. So in such case of Pitta Vruddhi, the Anshansh Kalpana will be Dravagunatmak Vruddhi of Pitta Dosh, and as there is Gati, upward Udva Gati, Shita Guna and Ruksha Gunatmak Chikitsa, so Dravya like Amalki, Dravya like Gairik are very useful. See the beauty of the treatment. In last lecture, when we discuss ulcer, you have to give Snigdha Shleshna along with Shitagunatma Chikitsa as for Pitta Shaman, and here exactly opposite of the Snigdha Guna, Ruksha Guna is much more beneficial because it will Shoshane Ruksha. By this rule, it will absorb that Dravagunatmak Pitta Vruddhi. Mashi Kalpana, for example, Amalki Mashi like Kalpana are also useful as they absorb this Dravagunatmak Pitta. So in this case you will have to use Dravya like Amalki, like Kiratitta, or Kalpa like Kamdudha, which will absorb this Drava, and hence line of treatment will be Shita and Ruksha. As I told you, Mashikalpa are also have excellent results. Now, at what time you should give this Dravya? First of line of action will be early in morning because the symptoms arise when patient wakes up in the morning. First line of treatment. Secondly, you can give this Dravya, whatever you want to give, at night before sleeping. So what will happen, that the Sanchit Pitta that drug will have effect on this Sanchit Pitta which is going to gather throughout the night. Now there are another treatment as far as this patient is concerned which come under Panchakarma. Firstly, give Virechan. Gati is Urdhva, patient has vomiting sensation. So if you give Virechan or anulaman, depends on the patient's condition, that gati will be reversed, and so this problem will be solved. Or if patient really has a fermenting pitta and amount is more, you can give vaman also, which patient many times induces on himself. So these are other type of treatment, but in practice, kalpa like gairi, amalki, what you want to do, or kanduda, etc., are very very useful, and patient gets immediate relief also. Now see again what the shades of this treatment. When I say amalki, it is ruksha shita, it is amla gunaatmak. So if you ingest that, it will get a good effect. You can use Sudarshan also, or Kiratikta. It is of Tikta Rasa and of Ruksha Guna. So it is Pitta Shamak, and it will also absorb that Dravagunatmak Pitta Vritti. No doubt about that. What care should be taken when you are giving Titta Rasatma Dravya with Ruksha Guna for this particular patient? Now see, patient has vomiting sensation already. So if you give Tikta Rasa by in the churna form, Tiktaras itself is a Vamanotkleshakarak. So what will happen? It may increase the Utklesh. As I said just before, that if you are going to induce Vaman as a treatment, then give Titrasatma Dravya in the powder form. Let the taste should be felt by the patient, and it will provoke or induce that vamana because of tikta rasa, no doubt. But if you want to use tikta rasa as a shamana chikitsa, then in spite of giving powder, you should give them in the form of tablet, or powder should be given in the form of capsule, or in any other form other than churna. Because if you are going to give shaman chikitsa and dravya like Kiratikta are given in the powder form, because of their strong tikta rasa, they may induce vaman, and the aim of shaman chikitsa will be far away. So this is the yukti. In case of amalki, amla gunatmak shita ruksha, you can give in powder form. But in the case of tikta rasa with shita ruksha guna, in this particular patient, give them in the tablet form or in the capsule form. Then only, as for shaman chikitsa, your aim will be reached. So these are the beauty of the Ayurvedic treatment. Same disease, patient coming with the symptoms, but according to Hetu, you have to change the line of treatment. First type of patient we saw, just I will revise, that Agnimandya, Amapatti, etc. Then Dravya like Deepan, Pachan or Sudshakar with Tishna, Ushna, Vidahi, Annapan as a Hetu. Then Shita, Snidagunatma Chikitsa to prevent the ulcers or reduce the erosion, like so Yashtimudu, Sarivala Dravya. Third type of patient with Pitta Vruddhi and mainly Dragunatma Pitta Vruddhi. So Shita, Ruksha Chikitsa, if you are using Pitta Rasa, don't give in powder form. For Shaman Chikitsa, give it in the tablet form. Otherwise, you can use it Mashikalpa also, or any other drug like Amalki, Gairi, etc. So these are the different shades of patient which we come across in practice so oftenly. Hence, I have taken so much time to discuss this under the heading of Amla Pitta. The last type of the patient which are easy to treat, that long-term antibiotic, long-term steroids or chemotherapy drugs which has common side effect of pitta prakop, and in that case they have burning, vomiting sensation. So you can use plain shira dravya, pitta shama chikitsa to reduce that symptoms. If a patient is, you can give these medicines along with that medicines. First thing, if patient is having cancer and they have planned chemotherapy for a certain date, and you know that after chemotherapy patient gets this pitta prakop, which is very obvious, You can start the medicines before the chemotherapy for 4 days, 5 days, or even 7 days, and ask the patient to continue after chemotherapy also. So this proactive treatment will reduce the side effect of the chemotherapy with a very large extent. So these are the modifications you can do in your practice. I have taken much more time for Amla Pitta because it is a very commonly seen disease in our practice. Thank you very much.